Do you have back pain or neck pain and your doctor has offered you an injection? Are you wondering, is it going to be helpful? Well, in this video, I'm going to help walk you through that and whether it's the right next step for you. Hi, I'm Dr. Deepti Jain, and I'm an orthopedic spine surgeon, and I treat hundreds of patients with neck and back pain every single week, thousands every single year. And I see patients every day who are considering spine injections. So let's start out by talking about different kinds of spine injections. So the easiest, most simplest kind of spine injection to consider is what's called a trigger point injection. A trigger point injection is an injection that goes into the muscles around the spine. This is typically done in the office without very much pre-planning, and sometimes it can be done without any imaging guidance, or sometimes a doctor might use an ultrasound probe to confirm that that injection is going into the muscle. Very commonly, as with most of the other kinds of injections, this injection involves a steroid. Trigger point injections are one type of injection. Another type of injection is what's called an epidural steroid injection. That is an injection that is a little bit more of a procedure. Different doctors do it in different ways, but in short, the needle is actually placed close to the spinal canal or within the spinal canal. And therefore, the injection is actually performed to bathe the nerve roots in the steroid, to reduce inflammation directly onto the nerve root. There's also another kind of injection called a Facet injection, or a medial branch block. These are injections where the nerve that's going to the facet joint, that little joint in the back of the spine, or the facet joint itself is injected, and again, most frequently with steroid. All of these injections generally involve a steroid, and they have different levels of efficacy. It's really hard to know before doing an injection, is a patient actually going to respond to it? So starting out with trigger point injections, in general, that is a very low risk intervention that patients can undergo to potentially have relief. When I am talking to a patient about it, I will often say, I actually don't know if this is going to help you or not, but we don't know until we try. So we can try the injection, and because it's a very low risk intervention that can be done, I think often it's worth the shot, no pun intended. So typically, the risks of undergoing an injection are things like infection, anytime we do anything in the body. However, that risk is extremely low. The other risk is because this is a steroid, it does have the possibility to elevate blood sugars. So if a patient has diabetes, we want to make sure that their blood sugars are well controlled before we consider giving a steroid. Those in general are the biggest risks of undergoing a single trigger point injection. And if it's useful, we can always give more trigger point injections in the future. Epidural steroid injections bathe the nerve roots. So those can potentially be helpful if you might have any sort of nerve-related symptoms or any sort of pressure on the nerves. Again, we don't know if it's going to be effective until you actually try it. And for some patients, it can be really effective depending on what their symptoms are. For other patients, maybe the first one works for a while, but then the second one doesn't work so well, or the third one doesn't work so well. And that's when patients are coming back to me as the surgeon.